thank you to everybody who is joining today. So glad that you're committing to spend the next hour or maybe a little bit more with us. And today's webinar is a collaboration between well-connected communities and county health rankings and roadmaps. So as we begin, we like to acknowledge that County Health Rankings and Roadmaps is based at the university, or is housed at the University of Wisconsin Population Health Institute, and is a collaboration with the Robert Wood Johnson Foundation. And in partnership with well-connected communities, we wanted to acknowledge their partnership between Cooperative Extension System, National 4-H and National 4-H Council, and they're working together to create healthier, more sustainable communities. So wanting to begin by sharing our learning outcomes for today. And by the end of our time together, you can expect to be able to define youth-adult partnerships, describe characteristics of thriving youth-adult partnerships, and identify strategies and resources to strengthen collaboration with young people. I want to highlight that there will be an exciting learning opportunity after today's webinar. Immediately following this webinar, we will offer a post-webinar interactive discussion group to deepen the learning. These conversations give you the chance to be face-to-face with other attendees and share what you are doing locally, as well as ask questions of other participants. Kate Conkle, who is a member of the Community Transformation Team with County Health Rankings and Roadmaps, will be our lead facilitator. And our guests, Joanne and Sarah, will join the chat to share more about their experiences as well. So keep your eyes on the chat box for details about how to connect to this opportunity later on in the webinar. And before we jump into content, I'm going to ask my colleagues here within supporting this webinar to start sharing their videos, and we're just going to introduce who is with us today. And just give me a minute, I'm going to stop sharing my slides. Great. So I am Allie Hevrilla, and I'm a community coach with County Health Rankings and Roadmaps. And next, let's hear from Joe.
Good afternoon or good morning, wherever you are, everyone. My name is Joe Hinton. I'm based in Chicago, and I am the voice that is talking to you in the chat box. I would love to hear from all of you throughout the day today. And as you chat, make sure that you make the little 2 windows say all panelists and attendees so that all of us can hear your messages. Thanks for having me.
Great. And Erica, how about you?
Hello, I'm Erica Burrows-Girardi, and I will be actually responding to your questions in the Q&A box. And I see, Allie, we already have a question there. Someone wanted to know, do we have any real-time captions? We actually don't have any real-time captions, but the recording will have a transcript, I think. You can access the transcript from the recording, which will be available within the next 24 hours. So if you have any questions, just continue to populate them in the Q&A box. I look forward to answering them.
And James?
Yeah, hello everybody. I'm James Lloyd, and I'm based in Madison, Wisconsin, and I provide technology support for the Zoom web conferencing tool.
Great. And Joanne?
Hi, I'm Joanne Leatherman, Program Director for National 4-H Council in Foundations and Healthy Living, and I'm tickled to be here today. I'm based in Maryland, about 30 miles north of Washington, D.C., where I still live on the family farm that I grew up on, so it's kind of cool. Thanks for having me.
And Sarah?
Hi, I'm Sarah Marvel. I'm from Connorsville, Indiana, and I'm just a very passionate youth about this subject matter. I'm glad to be here.
Great. Well, thanks everyone, and a little sneak peek behind the curtain around some of the voices that you'll be hearing throughout today's webinar. So I'm going to jump back over to sharing my screen now. And so just again, a reminder to keep your eyes on the chat if you're interested in joining us for further conversation. And I'm going to start today by framing a little bit about why we do what we do at County Health Rankings and Roadmaps. And so when we think about our why does County Health Rankings and Roadmaps exist? Why do we produce the tools and resources that we do to support communities? County Health Rankings and Roadmaps has two primary overarching goals. The first is to improve health outcomes for all, and this includes both how long people live and how healthy they are. Our second goal is to close the health gaps between those with the most and least opportunities for good health. We believe that everyone should have a fair opportunity to be as healthy as possible, regardless of where we live or the circumstances we're born into. The choices we make depend on the opportunities we have. Things like access to healthy foods or a quality education, or living in safe and affordable housing in a crime-free neighborhood. But not everyone has these opportunities. And so these unequal opportunities can create differences in health. And they don't come about on their own or because of the actions of individuals alone. Instead, they are often the result of policies and practices at every level that have created deep-rooted barriers to good health for some people. So I'm going to stop here for a second and ask you to reflect and think about your own community. And as you're thinking about your own community, I'd invite you to consider who isn't thriving, who doesn't have the same opportunities for health. What barriers have been put in place over the years? What will it take to remove those barriers and change the opportunities in your community? And so as you're reflecting on those questions and thinking about your community, let me begin to paint a picture. Imagine a place where everyone has a fair and just chance to lead the healthiest life possible. A place where barriers have been removed. Imagine a place where differences in race, culture, and perspectives are not only tolerated, but are celebrated as fundamental to health and well-being. Imagine that this is how we all experience our communities, regardless of where we live, the circumstances we're born into, or how we look. This is the vision of health equity. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. And in a moment, we'll hear from Joanne and Sarah about the opportunity to work with young people as a catalyst to improve health outcomes and increase health equity. But before we do that, we want to hear from you and get to know who's with us today as part of our audience. And so we are going to start sharing a poll that has a couple of statements. And I would just ask that you select all of the statements that best describe you and who you are as an audience member. So getting some responses here on the poll. Great, and we'll let it go for about another 5 seconds. And sharing those results, you know, it looks like sort of spread across the choices, but lots of excitement to learn about strategies to engage with young people, as well as, you know, some folks that are both working with youth and are focused on opportunity youth in community. So all really exciting. Thanks so much for sharing. So getting grounded in the focus of our conversation today, engaging young people in community change. Young people are speaking up and taking action to create change, and they are volunteering their time and energy to make communities safer, stronger, and more enjoyable. Young people help us understand the new norms in community and offer their perspectives on what might be possible. Working side by side with adults, they offer creative ideas infused with hope and the possibility of a better future. Partnering with young people fosters intergenerational learning and doing. So consider for a moment, what would your work look like if you included young people's input? Or if you're already working with young people, what are some of the ways in which you might increase young people's engagement? To help us get the conversation started today, I'm delighted to introduce Joanne. As she shared, she is the Program Director for Foundations in Healthy Living with the National 4-H Council, and she's been supporting youth-adult partnerships in various capacities for more than 30 years. Welcome, Joanne.
Thanks, Allie. Well, that makes me feel old, but at any rate, the 30-year part. But it has been my privilege to work with young people across the country in 4-H programs, and 4-H has engaged youth in creating community change since its inception in 1902. While today's 4-H members are not on the farm like they were at that time, I want you to think back to what our country was like at the turn of the century. Agricultural educators from the land-grant universities had some really exciting innovations to share that would make farming practices more productive and easier on the farm family. But the adult farmers were really hard to convince. The educators found that engaging youth in trying new practices through demonstration plots was the most effective way to convince the adults. You know, the old adage of seeing is believing. And so 4-H was born in its rural roots. Today's 4-H, like I said, is not so rural, but it seems that many organizations are turning to using this dynamic resource that we've used for over 100 years. The American flag in the background of this slide reminds me that the federal agency working group, among all of our federal agencies, have just released a strategic plan for engaging youth in federal agencies and events this year. So even our partners at the federal level are interested in having the youth ideas and the youth energies harnessed in community change.
Yeah, that's great, Joanne. And I had the chance to get a sneak peek at that resource, and we'll be sure to include it in our resource guide as follow-up to today's webinar for individuals looking to go a little deeper and learn a little bit more about what's happening at the federal level with youth engagement. And so at the start of this webinar, we mentioned that this was today's it's co-designed and brought to you in partnership with the Well-Connected Communities Initiative. And I thought a great way to get started for those that might not be familiar with what that means, if you, Joanne, could walk us through the visions, assets, and principles that are guiding the Well-Connected Communities work.
Sure, I'd be happy to. As Allie mentioned earlier, Well-Connected Communities is a partnership between the Cooperative Extension System and National 4-H Council working to create healthier, more sustainable communities. We envision a future in which community-based partnerships and coalitions create the very vital conditions for what you see on your screen. Healthy children to achieve more at school and throughout life, adults to be productive and thrive in all aspects of life, and all community members to enjoy equitable opportunities and equitable prosperity. So right now we have a pilot program with the 13 states that you see highlighted in the map. These are testing a proof of concept that have 4 major bullet points. First of all, youth leadership. Access and relationship with the 6 million youth leaders that we have in 4-H across the country. There are already 3.5 million engaged in healthy living projects. And these are driving change in their local communities. That's one of our foundational concepts. We have expert volunteers. Cooperative Extension Service trains volunteers to become master gardeners, master food volunteers, master family and consumer science volunteers, to name a few, and deploys them into communities to create change locally. With well-connected communities, we're going to have master health volunteers that will include youth as well as adults who are specially trained in specific topics to be able to extend Extension's reach into the communities with research and evidence-based best practices. We have an expansive reach with the Cooperative Extension Service. If you're not familiar with it, it's based in our land-grant universities in every state in the country and several of our U.S. territories. It expands the entire nation and it reaches into every community. There are different departments of cooperative extension. There's Family and Consumer Sciences, or FCS, which works a lot with FNEP, that's Expanded Food and Nutrition Education, and SNAP, maybe you've heard of that, the Supplemental Nutrition Assistance Program. And in my role with youth, I've worked extensively with a program called Engaging Youth Serving Community, EYSC, which enables CES to address issues from every angle. EYSC was a federally funded program through the Farm Bill that had a 10-year life. And we've extended those principles of engaging youth to change their communities in all of our 4-H healthy living work. And then we have best practices. Research that's developed at our nation's 116 land-grant universities directly benefits the program, driving innovation and impact for the communities as they learn what is the cutting-edge research and how it's been utilized in practice across the country.
Yeah, thanks for that overview. And just real quick, wondering if you can walk us through the well-connected communities principles.
Sure. There is a commitment, as you see on the screen, to transforming place. So what is good about our communities, but what can we do to make them healthier and to sustain that health without special grant funding? There's a focus on equity and inclusion. So we are reaching out to people in all avenues of life and intergenerationally as well. As you see, the intergenerational focus allows hope and action from people, youth and adults at all stages of life, balance what works and what's innovative, and learning and growing together. That's an important concept for a results-oriented movement.
Yeah, thanks, Joanne, for sharing that overview. And one of the resources we'll include is a link to the Well-Connected Communities site. So if you're with us today and interested in learning more or what activity might be going on in your community, you'll be able to check that out. And so before we jump into conversation around youth-adult partnerships, we want to hear from you via the chat. And again, the reminder that when you chat, please consider sharing with all attendees so that everybody can see your responses. But we want to hear about your experiences and the ways in which you are partnering with Extension, 4-H, and/or young people. So you'll recall from the poll, we saw that a lot of you are doing some great work with young people, and we want to hear a little bit more about that. What's going on in community? What's working? And here in a little while, we'll circle back and hear from Joe about some of the responses that have been chatted in. So thanks for sharing. And so, you know, one of the opportunities when we think about working with youth is to leverage the proven power and innovation of youth leadership. And young people are working alongside partners and community to provide their ideas and perspectives to help create and drive change. And so I thought, and one method of engaging young people is to form youth-adult partnerships. And so, Joanne, I thought a great starting place for today would be by simply defining what we mean when we say youth-adult partnership.
Sure, that's a great way to have everybody on the same page. The definition that you see on your screen came from the work of the international expert in youth-adult partnerships, which we call YAP for short, YAP, from Dr. Shep Zeldin from the University of Wisconsin. He has created a website rich with YAP resources, including an 8-lesson series of volunteer training modules that will be included in the resource section for those of you who are interested in a deeper dive around what does youth-adult partnership mean. So youth-adult partnerships is the practice of multiple youth and multiple adults deliberating and acting together, and that's an important word, together, in a collective, democratic fashion over a sustained period through shared work intended to promote social justice, strengthen an organization, and or affirmatively address a community issue.
Great.
So I'm sorry.
No, go ahead, Joanne.
Say a little bit more. The important part of this is that youth and adults take the time to share ideas, experiences, and perspective. It is the sharing that builds mutual trust and respect that is important to this whole relationship. When youth and adults start to really listen to each other and start to brainstorm, then synergy occurs. And it is this synergy that leads to authentic, and I want to emphasize the word authentic, partnerships among the younger and the older. It is the authentic partnerships that can lead to positive change.
Yeah, thank you. And thank you for going a little deeper and unpacking that definition even a little bit further. This definition was shared with me in February of this year, I believe, and I have just so enjoyed seeing how it can come to life in community. And we're going to hear from Sarah in a little bit about her work as part of her work and her role as a youth in a youth-adult partnership. But Joanne, before we hear from Sarah, I'd love for you to highlight some of the perspectives, some of the characteristics of strong and effective youth-adult partnerships.
Sure, thank you, Allie. Yes, young people are engaged as equal partners. They are not talked down to. They're not given menial tasks that anyone could do. They are engaged for their thoughtfulness, for their energy, their enthusiasm, and their fresh perspectives. They are not instilled with old ideas or ideas that this isn't going to work from the past like adults could be. So they are engaged as equal partners. They're adult counterparts, and this is a partnership. They create opportunities for youth to co-lead within programs, organizations, and communities. And finally, this leads to synergy between young people and adults. And I can't emphasize enough that the foundational principle of that is trust that develops between the two as they each come to respect the abilities that each bring to the table on an equal basis.
Great, thanks. And so, you know, having walked through the definition and highlighting some of the key characteristics, I'm wondering if we could think about some best practices and strategies for integrating youth-adult partnerships either into existing community work, or if from the perspective of if an audience member was interested in getting started with the youth-adult partnership, what are some of those best practices and strategies that we might lift up today?
Sure, thanks, Allie. Yes, I think it's really important that you think about how would you integrate a new adult into an existing group of adults, because many of the principles around integrating youth into youth-adult partnerships are the same as if a new adult walked into your meeting or was interested in joining your organization. So let's be sure that barriers to the youth participation have not been created. Be mindful of where and when you meet. A very clear best practice is to consider how you would integrate a new adult. And do you follow some of these best practices? Personal invitations to participate. Everybody likes to feel that their expertise is desired. So rather than a group email or a blanket invitation in a newsletter, think of youth that you would really like to invite to participate. Think about their transportation needs. Most parents or caregivers in a family work outside the home. So how can the youth get to the meeting? Is there free transportations or rides available? Can the meetings be held near a bus stop or a metro station? Can there even be a small subsidy to help the youth hop on the train or the bus to come? Virtual participation. Google Hangouts are popular. Zoom and other virtual opportunities are great, so that you can see each other and feel like you're in the same room, even if you're not. Think about youth and where they are during the day if you want to have them as part of your work. If you want youth who are in a public school situation, public or private school situation, meetings probably need to be held after 4 p.m. Are there homeschooled youth in your community that you could involve? You could think about providing a stipend for youth to cover their transportation costs, especially snacks at meetings. Are there icebreakers, a short one that you can integrate at the beginning of a meeting so everybody feels comfortable at interacting with each other? And the resources with these kinds of suggestions for eliminating barriers come from the University of Wisconsin and also Cornell University. And those references will be in your resource section at the end of this webinar.
Yeah, great, Joanne. And I think where you started is such a great nugget. You know, think about a time when you were inviting an adult into a partnership or collaboration or building a relationship with, and what are some of the things that have worked well, and then thinking about how that might translate into the space of working with youth. So now my colleagues and I once again are going to share our videos, and we're going to check in with Joe to see what was shared in the chat.
Yeah, thanks, Allie, and thanks, Joanne. Terrific discussion going on in chat, because I think your ideas were inspiring a lot of great thinking on this. And a couple of voices I want to lift up to kind of go along with your engagement ideas. Frankie mentioned in the chat that you have to meet students where they are, and I think that's just a general great overview for what we're thinking about. Angela mentioned work that's going on in community gardens and greenhouses with working with students. Mary Jo is a librarian who's working with all populations but loves to focus on youth. We have Lori and Melissa who are doing some extension work already. We have Alexandra, who's a student and doing great things with her robotics club. And we have Irma, who's a retired educator who's doing great work and continuing to do great work. So just all kinds of great voices. I couldn't keep up, there were so many. So I look forward to hearing all of those, and I know that the Q&A is probably going crazy as well at the same time. Kind of on that note, we had some questions that came in even before we started the webinar today. So we have one for Joanne that we can ask. Someone from Las Vegas asked that they would like to know some ideas for recruiting youth that are vulnerable to participating in risky behaviors. So I don't know if you have any thoughts on that.
Yeah, I did. Actually, I polled a colleague of mine who works with a program called Health Rocks, and it's specifically geared to educating and engaging middle schoolers in learning about risky decision behavior. And it utilizes youth leaders as well. It has teen leaders. And I know that some of her teen leaders have been formally engaged in some risky behavior and turned the corner, so to speak. I also thought about my work with engaging youth serving communities. Sand Bluff, Nebraska had problems within a Hispanic community with graffiti. And the young people were very convinced that people developed a negative opinion about their neighborhood and their community because of the proliferation of graffiti that was everywhere. So they went to the town council, got permission to install a graffiti wall and to also paint over all of the graffiti that was in any public place. And so for a while, every time they painted over everything, it came back, as you would think. But they went ahead, they put up their graffiti wall, and actually after watching this whole process, one of the graffiti non-wall participants who was writing all over public places asked to join their group because he could see the difference that it made in their community to have bright, clean places. And he decided that he didn't want to be part of the graffiti. And actually, after he joined the group, all the graffiti stopped, except for the wall where they were invited to do that. So Janine suggested that I share with you to make sure that when you're trying to recruit any youth, make sure that the youth's academic and after-school schedule aligns, because if not, they won't be able to participate no matter what. The content must be relatable to keep their attention. Try to figure out what risky behaviors apply to their environment and know the audience. Find ways to market to them. Do they have community service hours they need for school that they could use in their participation in this activity? So those were some of her suggestions, and I would echo them as well. Thanks.
Yeah, those are all terrific suggestions, and I think that we actually had a chat from Durant, and I think it was Durant, Mississippi. I think I missed the coding a little bit, but they were mentioning how that the eyes and ears of the students on the ground really do have a lot of impact on and incorporating everyone in the community.
Yeah, and Joe, I know you had another question queued up, but I know I'm also a little sensitive to time, so I'm going to go ahead and start sharing my screen and just encourage everybody. I see the active chat, so keep it up, everybody. And let me get back to our slide deck. And we're going to hear from Sarah here in a minute. And want to, just share my appreciation for Sarah being able to be with us, because what a better way to explore today's topic than to hear from a young person themselves. So a little bit about Sarah. She is a senior at Connorsville High School. She's in her 10th year with 4-H, where she's held several leadership roles and supports many community coalitions, community projects, excuse me. In addition to that, for the last 6 years, she's served as a member of the Junior Leaders 4-H with a focus on leadership and community development. She has a passion for theater and also enjoys designing pottery pieces and volunteering for many nonprofit organizations that involve young and old to make an impact in her community. And so we're going to start by hearing from Sarah about her experiences increasing awareness around the broad definition of health. And before we do that, I want to walk through the County Health Rankings model, which is the image on the left side of the slide that you're seeing. And this is our model for thinking broadly about health. And the County Health Rankings model illustrates that many factors, which are the blue boxes in the middle, impact how long and how well we live, or what we might call health outcomes. And those are the green boxes at the top. Together, we can implement policies and programs that make our communities healthier places to live, learn, work, and play. So welcome, Sarah, and I thought, just want to turn it over to you to have you share your experience around increasing awareness around the broad definition of health in your community.
All right, thank you. So I was privileged to participate in the National Youth Summit for Healthy Living. In return, it ignited a passion for bringing awareness back to my community and the importance of health in every sector in our community. After coming back, I have worked with our Junior Leaders program to help promote healthy concession alternatives for our stand that we have at our local fair each year, which attracts about 80,000 visitors each year. By working with adults and teens, we were able to reduce the amount of sugar products that we sold and increase the amount of fruits and vegetables, as well as reduce the amount of processed foods that were being sold at the stand. In fact, we increased the sale price on soda and lowered the price on water to engage healthy choices. As a result, we doubled our profits actually and significantly reduced the unhealthy food that was normally sold at our stand. And with this, I have actually been able to talk more about the economic impact that health has on a community. I have actually spoken with at several engagements with local civic groups in our community on the topic of health in hopes to bring kind of more awareness to the importance of looking at the impact of health. In fact, the community that I live in ranks 92 out of 92 for poorest health, which I share how this kind of affects the economic growth of our community, with new businesses not willing to really move here due to high health cost and poor health of workers. In addition, I have worked with other nonprofits to help verbalize the importance of looking for new ways to incorporate health into their programming.
Sarah, I love where the example you started with the healthy concessions and making the healthy choice the easy choice. That's so great. And then from there, sort of as you walked through your story to where your county ranks 92 out of 92, and would just share with the audience that as we were planning for today, you also shared that the county right next to you ranks 9th out of 92.
Mm-hmm. Yeah.
And so from the business perspective, that has some implications.
Yeah.
So moving from defining health broadly, what are some of the ways that you've supported assessing needs and strengths within community?
So one thing that we really kind of stressed at the National Youth Summit for Healthy Living was that the community knows what it needs. So I was able to participate in a community assets process to look at how to create healthy communities. This process included many county members, local government, business, and nonprofits at the table. During this process, I was able to give input into our needs and strengths as a community that pertain to health. And so I was just able to bring kind of the youth voice and kind of gather everyone and kind of help bridge the gap between youth and adults.
Yeah, that's great. And I love the acknowledgement that the community knows what it needs and really building on those strengths and assets that are in our communities. And so I'd love to hear more from you about some of the ways that you've collaborated with leaders across your community.
So I'm involved in a pilot program sponsored by Purdue Extension 4-H and NEP to help establish a health coalition in our community, which will involve youth and adults. Through this process, I have had to speak to the media, civic groups, and other sectors in our community to bring awareness of the needs for us all to come together and work on developing a healthier environment. I've spoke with nonprofit organization called Community Voices to seek their support to develop a partnership to be a main sponsor of a county-wide health coalition. I have spoken to their health capital on several occasions on how they could incorporate health in every aspect of their projects. As this time, several projects are in the works to make sure we address our lack of physical activity and high obesity among children and adults.
Yeah, great. Thanks for sharing some of those experiences. And as you reflect on those experiences, I'd love for you to discuss some of the ways in which you've overcome challenges and build on the strengths and assets in the community.
So I have found through speaking with many adults that the idea of youth being a voice at the table is something that is very foreign and hard for them to grasp. However, I have found that through collecting health data and sharing the importance of the future growth of our community among our youth, that their voice is important. Volunteering at our first Fayette County Food Council community-wide food drive to collect food for 8 food programs helped kind of bridge the gap between youth and adults by demonstrating the youth do care about their community and do want to be a part of the solution. I actually brought several of my friends along, and it was very interesting to see them kind of interact with a lot of the other adults and just kind of see them work together to accomplish a similar goal.
Yeah, I like that example of youth and adults volunteering side by side, and that really being a pathway for bringing youth to the table. So appreciate you raising that up today. Well, Sarah, thank you so much for sharing your knowledge and experiences with us, and just want to recognize that we believe this might be the first youth guest on a County Health Rankings roadmap, so thank you for being the first and hopefully setting the stage for many future youth to join us and share their stories as well.
Thank you.
Yeah. And as we get ready to answer some more of your questions, I just wanted to share ways that communities use County Health Rankings and resources, or excuse me, County Health Rankings and Roadmaps resources. We work to support communities by bringing people together to look at the many factors that influence health. We help them select strategies that can improve health for all and close gaps, and make changes that will have a lasting impact. And so we do this at County Health Rankings and Roadmaps by providing data, evidence, and guidance for communities. We also work to gather and share stories of communities around the country that are at different points on this journey to serve as examples and inspiration. And actually, some of those stories are exactly what we want to highlight today. Specifically, 3 communities that have been recognized with a Robert Wood Johnson Foundation Culture of Health Prize and are engaging young people to serve their community. So first, in the city of San Pablo, California, young people serve on a youth commission that advocates for community concerns, empowering young people to become positive agents of change. The second story is that of the Seneca Nation, where young adults are helping to preserve the culture. And in Brownsville, Texas, youth leaders lean in and shape pedestrian-friendly changes to the built environment. So these examples highlight that everyone should have the opportunity to lead, youth included. So we'd encourage you to check out their stories, which will be linked in the resource guide. Or you can view a Facebook live chat between Robert Wood Johnson Foundation President and CEO Rich Besser and the young leaders from these communities. So just a great opportunity to continue to listen and learn. And now we are going to, I'm going to turn it over to Erica, and she's going to facilitate Q&A.
Thanks, Allie. The first thing I want to say is, boy, have everybody been really, really active in the chat. And a couple of you wanted to know how you can connect outside of this webinar. So Joe has actually invited you all to share your location, name, your email addresses, just ways that we can somehow facilitate a way for you guys to connect later on. So I want to let you know, don't worry about trying to copy email addresses from the chat. We will take care of this for you, but I do want to let you know, if you place your email address and name and contact information in the chat, it will be shared with people who will be getting the resources from this webinar. So just want to be clear about that. So thank you so much for participating in that and sending in your questions. Joanne, this first question is for you. And it's coming from some communities that are in rural counties in the United States, in the states of South Carolina, Oregon, and Texas. And they're wondering, how can we connect youth that live in rural communities?
First of all, when you think about youth in rural communities, you need to think about that there is a unique set of problems or issues or challenges and potential barriers to working with youth in very rural communities. The EYSC program that I worked with for 10 years was directed at youth in very rural communities, and the smallest rural community I worked with there had 400 people. So if you say, well, there's maybe 20% youth, there's maybe 80 youth out of that community. And the problem with rural communities is that the youth leaders are often on the sports teams, active in student government, and however can you ever have time, get them to have time, even if they're interested in helping with your community issue. So you need to go back and think about, well, what are some creative ways that I can engage those youth? One of the very small communities that we worked with, the adults actually brought breakfast and met with the young people in the library before school. They worked with the school to get permission to be able to do that. They all enjoyed some breakfast together, and they had their meetings at 7:30 for an hour before school began. And that worked really well because it gave the youth a chance to be involved if they wanted to, but it was at a time that didn't interfere with after school activities for them and getting home and getting dinner and so forth for the adults. So that worked well. So you might have to be a little creative. I noticed in the chat someone suggested Facebook, and there are certainly virtual opportunities abounding now that you could meet with youth at times that work for them and work for adults. But you need to remember that in rural areas, often young people have multiple things that they are interested in doing. Of course, we want to try to engage kids that are not in that active track. So, but you sometimes need to start with the youth leaders to get to the youth that are on the skirts, the outskirts, and meet with guidance counselors or teachers or principals who know of youth that might be hanging on the fringes that could be tapped for this. Sometimes, like I said, it just takes, you need to ask and kind of work from there with the best practices that we suggested.
Joanne, that's just such a wonderful advice. I mean, take it for somebody who grew up in a small town where the local barber was also the bus school driver. But anyway, I mean, and you're absolutely right. I mean, these youth leaders are wearing multiple hats, and I never would have thought about coming to meet with youth in school before school, because all we did was just stand around in the schoolyard. So we could actually have been using that time rather productively. So that's a great idea. Thank you for that. Sarah, I want to ask you a question, and then I'm going to also ask Joanne to weigh in on this question as well. But a few people wanted to know, after they bring youth to the table and they involve them in the planning process, what are some tips for keeping them interested to sticking around until they actually get their project off the ground, so youth can not only help them plan the project, but can help them implement the project? So Sarah, do you have any suggestions for that? And then I'm going to actually ask Joanne that question as well.
All right. Honestly, teenagers love food. We love food. So that's always a great way to kind of keep us engaged, especially during meetings. And just trying to keep it light and fun. Don't make it too serious. Because, like, if you have a kid and they're sitting through a 4-hour-long meeting, trust me, I've been through a few of those, where it's just a bunch of adults just kind of talking and stuff, it's not really going to be that engaging, especially for the youth. So just trying to keep it nice, light, and fun, and just more interactive is probably the best way to keep the youth involved.
That's great. Again, such a practical response that probably most of us adults were overthinking so much that we're like, oh, okay. So thank you. Joanne, what do you have anything that you would add to that?
Yeah, I would add to make sure and that what you're asking the youth to do is important from their perspective. Far too many times I have seen youth asked to give out papers, asked to do cleanup after the meetings, but ask them to take a meaningful part of your project, whatever it is. Maybe their job is to recruit 20 more youth to help with a certain activity, or to be part of planning the agenda or even the budget. One community that I worked with, it was the youth who went after some grants. They learned of some grant opportunities that would help fund projects for their issue, and they got a couple of adults to help them, and they went after grant money. So think about being authentic and real, and give them responsibilities and hold them accountable if they become engaged in that.
Great, great. We do have a number of great questions that are coming in, and I do want to remind you that we're going to have a discussion group after the webinar today. Joe is going to be chatting out the webinar link. The link for the discussion group later. But I just want to let you know, if we don't get to your question now, please bring your question to that discussion group if you can join us, because that way you can, we'll have some time to answer your questions. Allie, I do think I have time for one more question. What would you say?
Yep, I'd agree. One more question and then we'll move on to wrapping up.
Okay, so Abigail is wondering, and Joanne, this is probably best for you. Abigail's wondering if there are any examples or information on incorporating young adults into clinical settings. Like, how could they participate in that type of a setting? And you're muted, so just want to remind you about that.
Muted. Here we go. Yeah, that's a challenge, because very often clinical situations have really strict rules around hygiene and screening and privacy issues. But I think that young people in a clinical situation could help with work in the front office, collecting information that people, you always have to fill out some kind of form. Maybe they can interact with the children. I'm not sure what kind of clinical situation you're talking about, but maybe they could offer a child care service at peak times when parents are bringing their children and don't want to take them into the clinic. Maybe that's an option. That's Sarah,
Yeah.
I don't know if you have any suggestions, but
you're right. There are certain limitations, and in some cases you may have privacy limitations as well, like privacy laws, like HIPAA laws. So so think about ways that youth could be involved, but not necessarily where you're going to be violating privacy or infringing, putting people at risk for infection or something like that. I think there are always ways to include them, though. So thank you, Joanne. Thanks, Sarah. I'm going to turn it back over to Allie, and we'll start to wrap up. And don't forget to look for that link that'll be coming for the discussion group soon.
Yeah, great. Thanks, everybody. Work is underway for our next webinar, so just wanted to share the opportunity to join us January 29th. For our webinar on policies and programs to help build a culture of health. And so look for that registration link coming soon. And again, the discussion group is coming up, and so Joe is going to get ready to chat that link if you're interested in joining us in the Zoom room. And we'll continue to explore the strategies we have talked about. We do use the Zoom technology, so if you have a webcam, we encourage face-to-face to help build strong networks. Capacity is limited, so head over immediately following if you're interested. And to get your thoughts for the post-webinar discussion, we want to hear from you, and so I'm going to launch a poll and just would love to hear what you would like to discuss. And so in that discussion group, are you interested in talking about what are the opportunities to work with young people? What could a youth-adult partnership look like? Or how to deepen connections with young people? Or something else? And we can learn more about what that something else is when we're in the room. Yeah, and we'll give folks about 5 or 7 more seconds here. All right. And so it looks like a little bit of a split between what could youth-adult partnerships look like and how to deepen connections with young people, but also a fair amount of interest in the first option. What are the opportunities to work with young people in community? I'm gonna stop sharing these results. And again, just want to thank everybody for their time, for joining us today and spending some time with us, and encourage you to stay connected with us via these various channels, Facebook, Twitter, and our e-newsletter if you aren't already signed up. And again, thank you, and you can always visit us at countyhealthrankings.org. And with that, this is the registration link for the discussion group, and we look forward to seeing some of you over in that space. Have a great afternoon and rest of your day, everyone.